we're starting today with something we've spoken about a lot over the last year.
Well, we've all heard about the apparent benefits of vitamin D, but is there now proof it can prevent coronavirus?
Well, a new study published in the American Journal of Clinical Nutrition has found that taking regular vitamin D supplements could reduce your chances of catching the virus by up to a third.
Well, to discuss this, we're joined now by Dr Michael Mosley. Morning, Michael. Thank you for joining us today. So, obviously, I mean, I take zinc every day because you told me to at the beginning of all of this. So now we're on to vitamin D. Is this a reliable study?
It's a good study. It doesn't prove that vitamin D is going to do magical things. What it was based on something called UK Biobank, which is a big resource of people. And what they did is they asked them lots of questions about 10 years ago and have been following them ever since. They also tested them for their vitamin D levels. And what they found in this latest study was that if you said you took vitamin D supplements, then you were a third less likely to get COVID-19 than if you didn't say that. So there are lots of other things going on in people's lives apart from taking supplements. But what you really want is an intervention trial where you give people vitamin D and see if that cuts their risk of developing COVID-19. And those studies are being done at the moment, but the results are not out yet.
So it all sounds very positive. What's the NHS's stance on this currently?
So the NHS has been recommending for some years now that people take vitamin D during the winter months, which is now, because it's known obviously as the sunshine vitamin, because you get most of it from sunshine. You can also get it from oily fish, but it's mainly from sunshine. So the NHS says between September and March, April, the British sun is not strong enough. So unless you're an influencer out in Dubai, you're not going to be getting enough sunshine, therefore enough vitamin D. And they therefore recommend that pretty well everybody takes around 10 micrograms of vitamin D. That's about 400 international units. And you do that during the winter months. So at this time of year, January, vitamin D levels are at an all-time low because your body stores it, but then kind of gets through it during the months in between. So about now, it's probably as low as it's likely to be.
Well, we're always sort of cautious here on, sort of random facts that are thrown around. And the NHS have actually said it's known as a sunshine vitamin, reducing the risk of... there have been some reports about it reducing the risk of coronavirus. Currently not enough evidence to support taking vitamin D to prevent or treat coronavirus. Public Health England, National Institute of Healthcare and Excellence, NICE, and the Scientific Advisory Committee on Nutrition convened and said that there's still waiting for sufficient evidence to support vitamin D supplementation with the aim of preventing or treating COVID. It was still lacking, should be further investigated. So obviously, nobody, it's not going to do you any harm, and so no one's saying...
Absolutely. What the NHS says is you should be taking it anyway because of the other benefits for bones and things like that. In fact, the only real argument now amongst the experts is the dose. So the NHS is still saying that 10 micrograms is enough. The Royal Society came out with a report just before Christmas saying 25 micrograms. So, for example, I'm taking 25 micrograms at the moment. Again, it's very safe. It's kind of down to you. But broadly speaking, that's the debate. What dose should you have, not whether you should take it.
Because if you've got sort of a multivitamin, if you've got a multivitamin anyway, or if you're getting vitamin D in your diet and then you're taking 25 milligrams like you're saying there, I mean, what happens if you overdose on it?
It would be quite hard. So you'd probably have to take 4 times that dose to be, vitamin D is incredibly safe. The only people the NHS advises, if you like, not to take vitamin D are babies who are currently on formula milk, because the formula milk is fortified. So you can buy online vitamin D at, 100 micrograms. I wouldn't advise that at all. 25 micrograms is very safe, and anywhere between 10 and 25. As I said, the NHS advises you take it anyway, irrespective, of the benefits for COVID-19. It's good for all the other stuff. We know that it reduces your risk of getting colds and the flu and things like that. That's pretty unambiguous. And as I said, the Royal Society came up with this report just before Christmas. And the people who are most at risk are the elderly, particularly if you're indoors because you over the summer you haven't built up those reserves, people in institutions, prisons, and people who are overweight or obese, because vitamin D is a fat-soluble vitamin, so it tends to get absorbed in the fat. So people who are overweight or obese, and obviously people with darker skin. And some people believe that one of the reasons that people from ethnic minority groups are getting COVID-19 and dying from it in greater numbers is at least in part because they tend to be vitamin D deficient. And we know that if you're deficient, you are at much greater risk. So as well as cutting your risk of getting it, there are some big trials at the moment where they're giving people in hospital very big doses of vitamin D to see if that will, shorten the stay in hospital or indeed help save lives. And those studies are underway at the moment.
I was looking online today about sort of getting vitamin D, how you buy it, and there are tablets, which you say, and there are sprays, but also the dosage is quite confusing. 3,000 IU, 75 UG. I mean, you saying you're taking 25 milligrams. I mean, I don't understand any of that.
25 micrograms. I'm taking 25 micrograms, which is
right. That's another one.
Which is 1,000 international units. And so I would have said taking 3,000 is unnecessary and not a good idea.
So the 3,000, that's a lot of them online. It's too much.
Yeah, and that's about 9 to 10 times more than the NHS recommends.
Wow.
I think that's probably producing very expensive whey, because a lot of excess vitamins just get excreted when you consume them.
So why is that?
The NHS
why are they being sold in that quantity? If 3,000 IU is unnecessary and 10 times what you should be taking, surely you shouldn't be allowed to do that.
Well, they're pretty safe, is all you could say. A GP can prescribe up to 20,000 units for people who have insufficient or are deficient. So, this is a pretty safe vitamin. So I don't think they're doing anything dangerous, but certainly the NHS says you should not be consuming on a regular basis more than 4,000 international units a day. And frankly, over 1,000 is probably unnecessary for the vast majority of people.
Just very quickly, if you don't want to pop a pill and you just want to eat your vitamin D, what kind of things can you find it in?
Unfortunately, almost nothing. So oily fish, if you consume a lot of that. Seal and seal blubber, I'm told, is very rich in vitamin D.
I saw that in Lidl the other day.
Got that on my Ocado list.
Straight down to Lidl for the seal blubber.
The only other thing, mushrooms have some vitamin D, but they're best left out in the sunshine because, like us, they also generate more vitamin D if you leave them in the sun. Bit tricky this time of year.
I was going to say, if there's sunshine to be
What about
had,
those sun lamps? What about the lamps that you can buy?
They're normally filtered out. You need ultraviolet, UVB you need, and that's normally filtered out, certainly in the light boxes. In the sun lamps, yes, but obviously, there are risks of being exposed to too much UV light.
Just very quickly, it's summer in Brazil at the moment. We're looking at the figures of COVID in Brazil, in Manaus in particular. So I'm assuming that they're getting a lot of vitamin D, but it doesn't seem to be helping their numbers.
No, I wouldn't know what the levels are because I guess it would depend on how dark the skins are and also how much time they are spending outdoors. But vitamin D isn't going to save you from everything. All it demonstrates is the most you can claim at this moment in time is it may cut your risk. It certainly won't. It's the normal stuff. You've got to wash your hands. You've got to keep away from people. You've got to practice. You've got to socially isolate. Those are the most important things. And vitamin D may help a little bit on top of that.
All right. Thank you. Good to talk to you today.